messages have you received?
No, I just wanted to a little bit educational part for young athletes who may be still learning and sometimes don't understand anatomics and mechanics so well. So I get few questions. People have some pain in elbow when they're doing top row, when they go for some pronation and they say the medial elbow hurts. And exactly inside of elbow, and they are watching Todd Hutchings, they are watching Mindaugas and many others who are recommending to do GM presses, who are doing some wide grip, externally rotated presses and strengthening the elbows and saying that it will help for your elbow pain, and definitely it's great exercise, it's great, it's strengthening all this medial aspect of elbow, and if you have problems with UCL or collateral ligament, it could help. The thing is, very often you have some pain or sensitivity because structure is too weak to tolerate stress and load. And if you want to put more load, it's not strong enough, and you start to feel some pain, discomfort, sometimes some micro injuries and so on. But the thing is, that's not only what can hurt in your elbow. It's not some one magic exercise what will help for anything. So if we talk about anatomy, all wrist, finger flexors, all this common tendon connect to medial elbow, and if you have problem that it's in this flexor tendon, most likely GM press will not help you much.
because all the tension goes here and wrist is not involved.
And then what you have to work is with your wrist and with your hand and with your fingers, you have to slowly, systematically, but increase ability for flexor tendon to hold the stress and loads.
Question. Where do they start? Because we have finger flexors and we have wrist flexors. So do they start from, because this is the deeper layer, right? Finger flexors.
But it's still one common tendon. And by theory, most often you start with static exercise. So it could be static holds for a wrist. It could be static holds with some teeth handles for a tendon. Under level of pain, 20-30 second holds, 3-4 sets. If static feels good and your reaction to stress, to load is fine, you do that for some period, it's all good. You slowly move up to some dynamic loads and eccentric loads as well. But I would recommend to start with static for tendon, where tendon can, without any change in muscle length, so it's a static load and if it's tolerate stress, that's all good. Also, same pronation. If guys are saying that I do my top roll and my medial elbow hurt, I would look what's happening with your pronator. Very often.
So the pronator, you can see here, but it comes through here and it goes all the way here.
Exactly. It's also comes here and it's connect to your medial elbow. So it's same tendon. It connects here and it could give problem. And what you have to work with your pronator. Generally, again, under level of pain, under level which that tendon can hold, you are slowly increasing ability for tendon to tolerate stress, and it could be long. It could be long. Tendons, the worst part with tendon, it's very slow responding, and it could take in an acute period, if there's some small minor injury, you need those 2, 3, 4 weeks, sometimes a little bit more for acute period be over. After that, this period when tendon changes its structure, so it's like a rebuilding period. You slowly start to build up, and it could take up to 6 months or sometimes even more after some bigger tears, bigger tendon damage, or sometimes those tendonites. So do your GM presses, do train your internal medial elbow with different press exercise, but it's not a magic. It's not a magic tool for everything. It helps, but it helps for specific thing. It helps to strengthen your medial aspect of elbow, but it's not all what's happening in elbow. So be smart, think a little bit more about anatomy, think a little bit more about what's happening on table, what muscle group or what is involved in movement when you do that. Test isolated, do some wrist, do some pronation, even biceps. If it's some tendonitis of distal head of biceps connects here in also elbow, it could give you similar pain. So test what is happening and find a reason, then work with that reason. Like often we say like test, don't guess. Yeah? So
Yeah.
find what's happening and
Go
then
to
work with it.
physiotherapist. Like everyone asks me like I'm a doctor. They're like, my elbow hurts, and they don't even say like because of this. And I say like, listen, go to some specialist
Yeah.
and do some tests.
And best find some physios or chiropractors or whatever who understand a little bit more about arms and sport
Yes.
specific. Not
Yeah.
everyone does. Not
Yes,
everyone
that
does.
is true.
So
That is
if
true.
you find someone who have some maybe sport background or who work with athletes, they will usually understand those things better. Some who have some biomechanical understanding about what's happening in sport.
Send messages to Jans. Don't send messages to me. Because like every week I'll receive a ton of messages of people that like, I'm like, okay, I have a pain here, I have a pain here. And I'll be like, listen, dude, I can't do magic. You know, like you have to, I can't do this. You have to go to a specialist. But the thing, like there's things that you can still do on your own and it probably will get better. Like Jan said, like train your fingers, train your wrist, you know, build.
It's question. You have to find first out what's happening, what's the problem, and it's very hard to fight without understanding what's happening.
Yes.
Even sometimes there are things or times when diagnostics is not must be, but there are times when you see that injury is for maybe like 2, 3, 4 weeks. It's just getting worse, not improving. Maybe you have to do this diagnostic. Maybe you have to see what's happening. If no one can tell you directly, or just like, oh, it could be overuse. Yes, it could be overuse. It could be, but we don't know.
Statics is always a great way to start, like on all the movements. And like even when I have a little bit of injuries, a little bit of pain, I will start by like doing some static motions, you know, building, because in static, the tendon gets a very good amount of blood, very good amount of tension, because you don't change anything, but your muscle has to pull harder to hold it in the same place. It pulls harder on the tendon.
But it's one more thing to remember. If it really, you heard some kind of sound, when something is tearing, something is breaking, something is damaging, and there could be potential tear on soft tissue, any soft tissue, ligament, tendon, muscle, usually for first few weeks generally do nothing. Do nothing.
Just leave it alone.
It's like you have cut your skin and it's need to start this scarring process, and you are opening it up. Worst would be to stretch. People always like, oh, stretching is good, stretching is great. If right after injury you try to stretch that area, most often you will just make it longer in this whole time. So normally, if it's tendon problem after some acute injury with really potential ability of some damage, you need those 2, 3, 4 weeks of not trying to stretch it. Maybe some very easy blood flow, but I would also, if it's bigger tear, not recommend to do that from week like first or week second, but give some time.
Yeah. And with tendons, you have to understand, like Jan said, it like sometimes in arm wrestling, very common thing is when you take a bigger break for 2 weeks from very heavy lifting, your tendons have a time to recover, and you suddenly have superpowers, because tendons do take longer time to recover. And if it's injured, it takes even longer. So just don't rush these things. It's not like a muscle. You're gonna do it and
very slow responding. That's the thing with tendon. And you said about send message to Yanis. Of course, I try to sometimes help someone, but thing is, even when you see someone personally, not always you can solve the problem quick. But when someone through internet just write you, okay, I have a pain in my elbow after 2 hours of arm wrestling, it's super hard to from distance to imagine what is happening in the elbow.
Yes, you have pain in your elbow after arm wrestling. My elbow's hurt after arm wrestling. Yes, you do, buddy. Yes, you do.
Yeah. So I would suggest you train smart, think, analyze, and learn little bit. It will help you to understand better what's happening, and if you know some very basic things about mechanics, anatomy, about structure, it will definitely help in your training process, in your rehabilitation process, and in your career general.
Yeah. Anyway, stay healthy, guys. Stay strong.
And love arm wrestling.